The key difference that no one wants to mention: training. This is the real boundary between integrative health and holism. Integrative health requires a foundational professional training in medicine, nursing, psychology, or other regulated health professions. It never abandons anatomy, physiology, pathophysiology, semiology, clinical diagnosis, risk assessment, legal and ethical responsibility. The integrative approach individualizes, does not serialize, contextualizes the patient, departs from the hegemonic model without denying science, proposes personalized treatments, not blind protocols. Holism, non-clinical. It does not require medical training. It does not always distinguish levels of analysis. It does not always assess risks. It may ignore biology. It may confuse belief with treatment. Inspiring, yes. Clinical, not necessarily. Integrative health without SYNCRETISM. Integrative health does not mix knowledge randomly. It integrates with discernment. Therefore, it does not replace medicine with beliefs. It does not discontinue treatments without evaluation. It does not propose a one-size-fits-all approach. It does not act without an epistemological framework. To integrate is to organize levels, not to erase them. Pharaoh summary. Holism is not clinical. Integrative health is. That is the fundamental difference. It is not an opinion. It is not a belief. It is an epistemological, scientific, ethical, and professional difference. And why is holism not clinical? Holism can be philosophical, spiritual, symbolic, experiential, preventive, supportive, and produce a sense of well-being. But it is not clinical because it does not require professional diagnosis. It is not necessarily based on anatomy and physiology. It does not assess clinical risks. It does not respond to regulatory frameworks, and it does not assume legal health responsibility. This does not invalidate it as a human experience. Why integrative health is indeed clinical. Integrative health stems from formal healthcare training, maintains the diagnosis, evaluates risks and benefits, individualizes treatments, integrates knowledge without losing sight of the body, and is ethically accountable for its actions. It integrates without diluting. It expands without abandoning clinical practice. The dangerous error. The problem isn't holism. The problem is presenting it as clinical practice. That's where the following appear: deception, symbolic iatrogenesis, abandonment of necessary treatments, blaming the patient if they don't heal, and invisible and then visible harm. And that is serious. If you enjoyed this topic, don't miss the next video where we'll explore holistic practices versus integrative practices, their respective roles. We'll delve into this with a scientifically rigorous, conceptual approach. A key takeaway for the next video: not everything that heals is a treatment, and not every treatment heals only the body. Confusing these two things also makes you sick. Final key learning. Integrative health doesn't mix different types of knowledge. It organizes them, prioritizes them, and fosters dialogue between them in service to humanity. Final key take. Integration isn't about believing in everything. It's about knowing where you stand when you accompany someone else on their journey. Remember that these videos complement the biology of meaning training, which is part of the Pharaoh integral model and method. Subscribe to the channel, like, comment, and share this video to raise collective awareness.